Welcome to today's episode of Angie B Presents, bringing you ministries, businesses, and people that make me smile. Today's episode finds me traveling to Orange Avenue in Daytona Beach, where I learned all about Caring for Others Academy, and I got a chance to chat with evangelist Belinda McMillian as she takes us on a tour of caring for others. Belinda.
Good afternoon. How are you?
Just wonderful. Tell us where are we today?
We're at Caring for Others Academy
Mm-hmm.
on Orange Avenue in Daytona Beach, Florida.
What's your specialty here?
I specialize in general education.
Mm-hmm. And so that sounds like English and math.
Right. General education is considered an equivalent GED. I'm the instructor of the GED program, which consists of math, English, social studies, international history, algebra, trig, and science.
And you offer all of this at the Caring for Others Academy?
Yes, we have two locations. We have a class here, and then we have a class at 437 Jean Street in Daytona Beach, Florida.
At the Gardens of Daytona.
At the Gardens of Daytona.
Okay. Now, why would I want to come to Caring for Others?
Caring for Others Academy consists of different topics. Phlebotomy.
That sounds like blood.
Yes. Main focus is CNA. For certified nursing assistants, where you take your state board here.
Really?
To be certified. Yes, we're on site. Where you take your state board. We do CEUs, which is continuing education.
That's like if you got your degree, but you got to keep learning.
Right.
CEU.
Okay. If you get your certified nursing assistant, you have to have CEUs that do it. Does it?
Okay.
They are renewal.
And
And you have to take them when you renewal. When it's time for you to redo it again, we do that. We also do home health aid.
Really?
Yes.
Those are the folks that can go in when you're
In the
handicapped
home.
or
Right.
a senior and you need somebody
Right.
coming home. Oh,
And
okay.
we also have EKG classes, I think. We have a topic of classes in the healthcare industry.
Tiffany? And how long have you been here, Tiffany?
About 7 years.
7 years. Okay, so what do you do here? When people come in the door, they see you.
I register all of the students in.
Okay. Have you seen any students to leave here and be successful?
Yes, we have students working at Halifax.
Halifax
Sandalwood,
Hospital?
Sandalwood Nursing Home.
Really?
On South Beach Street. We have students that work at Good Samaritan.
Wow.
Here.
Wow. What do you think is the hardest part about being a student here?
I don't think it's a hard part here. Everything is hands-on.
Okay.
Pretty much.
So as long as you think you can do it, y'all help you get it done.
The teachers do.
Cool. Now, okay, we're going to talk about the students that don't finish. You probably see something in them. Why do you think they don't get finished?
Well, we don't really have that a lot because most of the students that come and pay, they want to finish. They want to become a certified nursing assistant. So, of course, they come back and do everything they need to do to complete the program.
So there's a good success rate.
Yes, like a 99% passing rate. And the state has been coming in for about 6 years. I think 6 years now.
Okay.
The state come in and test the students.
Got it. Thanks, Tiffany.
You're welcome.
I appreciate it. Tell me some of the concerns from the students that you work with. What are they worried about?
Most of the concern of the students I work with, I work in the GED program. Most of the concerns are, well, do I have to have a GED before I get my CNA? The answer is no.
Really?
No. You can work as a CNA, but in order for you to continue your education For LPN or RN, you must have a state high school diploma or a GED. So without those two components, you cannot go any further. You cannot be a LPN or RN. You cannot get in a 4-year college without that. But a CNA, home health aide, phlebotomy, all of that, and we do CPR, which is a state requirement.
Oh, that's good.
And you have to have all these components sometime before you can even get in the LPN program.
My goodness.
Because you also get credit for it. You got to have some kind of work experience.
Okay.
You don't have to, but it's for your best benefit to have it.
Okay. Okay. Now, tell me about some of the students that you've worked with.
I've worked with students that are CNAs that want their general ed, and they've gone on to either RN or LPN school. I think it has been 3 so far since I've been a vendor here that went head on to Daytona State and got their LPN or RN. Majority of the students now, they want to work first. They want to get employment first.
But yeah.
Well, now employers, if you don't have a high school diploma, starting year 216, there's going to be a problem. That's very important. You must. Some employers are required. They require it. They won't even let you fill out an application. That's the first thing they ask you. Do you have number 1 work experience or a high school diploma?
Wow.
So if you don't have a high school diploma, work experience without education is no good. Education without work experience is no good. So it's best to have both. This is where the students practice on their nursing skills. CPR, how to make a bed, how to take care of patients. And this is something that Ms. Mill, she's the teacher for this program. Over here, this is where the students do their practice testing when they're in class. This is where they learn at a class setting, in a group setting, about CNA, phlebotomy, CEUs, CPR. This is the classroom setting for the program where we actually go and we have like 10 to 15 students in a class, and we do the one-on-one approach. Class is not over 15 students. The instructor is Mr. Camille or Mr. Corey Butler, and he instructs the class. They instruct the class from here, and this is the setup for the students. As the students, they take a break between settings, between instructors, and then they're welcome to sit in this area. This is their lounging area. And after they get done with that, they're welcome to open this door where the student exit out and go home or either go on break. But after they get off break, this door is locked. After they get off break, they have to come back through the receptionist area, through the other clinical, through the clinical area, the classroom setting area. They come through the clinical area and they come back to the classroom.
Miss Belinda, tell me about making the bed and some of the other things that they learn.
Okay, in this area, this is one of the clinical areas. This is where the student learns how to brush the teeth.
Really?
How to make the bed, how to take care of the patient, and to take care of the patient hygiene, and other body parts of the patient.
Okay, okay.
This is one of the clinical areas that is used to practice for the CNA program.
And they practice on this?
Yes.
Okay.
And they practice on each other.
Oh.
Yes, ma'am.
I like the information that's here, Miss Belinda.
This is one of the illustrations that is taught to the patient, to the class, when we are doing materials in a classroom setting. This is part of the information that they get. Mr. Corey also each student have a booklet that they are preparing for the CNA program. And in this section, this is where the instructor actually sits and answer questions and review the CNA program.
I see it here. Range of motion, transfer, like you said, mouth care, brushing teeth.
Right. Everything that you see on the clinical skill listing board, that is what is taught to the CNA. with one-on-one practice
Wow.
with each other, and with simulation dummy simulation. The instructor actually go through it with the simulation of the dummy. Then each student take turns and work and do it.
Now, what do you want people to know about the importance of education? I know, growing up, everybody tells you go to college, get a good job, but you've made statements in the past about that. So tell me a little bit about.
Well, college isn't for everybody.
Right.
And sometimes individuals that make a trade and that takes up a trade like CNA or home health aide, they make just as much money. It's where you want to go. It's the passion of the job. And it's not about, it's either or. If you want to further your education, it's some things you must do. But sometimes people just want employment. And when you want employment, you have to be trained. Nobody's going to hire you up as a CNA and you're not state certified. Because there are laws against that.
Yeah.
And you have to come and register. And since I've been a vendor for Haynes and McMillian, been a vendor for Parafathers for 2 years, and I've seen it grow. And I've seen a lot of young ladies come out in here and get great jobs, from hospital to nursing home to private care. It really is an amazing school, and it's minority black business owned.
Now, I know when I first walked in the door, I met the lovely Tiffany.
Yes.
And she said she's been here for 7 years.
Yes, she has.
That's great. And she greeted me at the door, but I understand that she helps register the students.
Right.
Okay, now if I wanted to come as a student, what do I need to register?
You need to have your driving license.
Okay.
And we have a student loan program.
Really?
Yes, we do. We have a student loan program, and you have to register for your classes. You have to come in with a money order, or either we have a student loan program where it assists the student with the educational financial need that they need.
Okay. And then is this like a 10-week course, or go at my own pace?
It's a 4-day course.
4 days?
CNA is 4 days.
Wow.
And the other nursing programs, it consists, Mr. Corey has them on schedule. But the CNA is for 4 days.
Okay.
And Mr. Corey and Miss Camille teach those programs. And we have 3 RNs that are on staff that teach the other classes.
And then your aspect, the GED program, how long does that take? Am I going to be working on my GED for 6 months, or?
That's up to you.
Oh, yeah, I've seen that you've been patient with people.
Yes, the GED, there is no time limit. The GED takes time. You have to have patience. Let's say you want to get your GED in 6 or 7 months. Well, guess what? If your reading score is at a 6th grade level, it's not going to work. So GED, you have to have patience. It's continuing education. Okay. That's why at some colleges, like at Daytona State, they have what they call re-enrollment. Like you will do a GED, and then you go straight into college, where we pre-prep you for the GED, and we send you out to Daytona State. We are not a state testing when it comes to GED.
So you just getting us ready.
We just prepare you, and after we prepare you, we send you out to the university, Daytona State College, Daytona State University, to take your test.
I got it.
I wanted to do the GED because I was doing it at Daytona State, and they have me doing at the cave, and like they're going after 50 hours.
Yeah.
And for you to test. And then like I'm doing 3 classes, the reading and the language, but then they're telling me I'm gonna have to pay another $30 and then wait $50. To test 50 hours. That's over 2 months. I'm taking it for me to test the go. Exactly.
I'll let you take your stuff home. And if you work at your own pace, I'm in the classroom with you, but it's up to you. If you we got a simulation tape. Whenever you get ready, think you want after the 4 weeks, you take it and you move to the next lesson, because we do it in a group setting. And then if you need me one-on-one, I pull you to the side and okay, so you got to work on this, and I keep a portfolio
Mhm.
of all my students.
Mhm.
Whatever you have done, I keep a portfolio so you can see what you have done.
Mhm.
So you will know exactly what's going on. So you will know, well, is this something I need to work on? And sometimes I will actually, well, since you're getting the test, I actually go a little bit further with relatives, because you're my relatives too.
Mhm.
That's my baby. I let you take a simulation. I let you take the GED simulation test. I let you take it home.
Mhm.
And it shows exactly what you need to work on.
Mhm.
You take the whole test, it shows you exactly what that you'll need a 90%, 80, because you need 460 to get the test.
Mhm.
And you just take your time, you take it at your pace. And no need of rushing through something when you ain't got it. What's the need of you gonna pay for a tape and you ain't got it yet?
Mhm.
You gonna do your preparation, and then you pass the simulation. That is the tape.
Mhm. Mhm.
So
Is that everything together?
Yes.
Social studies?
It's everything. We take one class at a time. We don't do, okay, let's say you're at Daytona State. We don't do English this hour and math the next hour. No, we don't do it like that.
Mhm.
For 4 weeks straight,
Mhm.
4 to 5, 6 weeks, we stay on one subject.
Mhm.
Then we'll go to the next subject. Because like now we're in literature, English, and reading.
Mhm.
And then we'll go to the next subject.
So we'll test out of that?
Right.
And we'll-
You will test out of that.
Uh-huh.
You will take it on a simulation.
Uh-huh.
And if you read chapter 460 on that, if you want to go out there and take your tests one at a time, that's what because you don't test with me. You test out there. I'm not a state tester. I don't do that. I prepare you for it. And once you have reaching up to that score, because your scores are there to stay. Okay? They just made a new rule. You don't have to take all the tests at one time. You could take the test in parts. So that's why we take it part by part. We're not trying to say, oh, let's do math this day and then let's do English this day. No, you get it. I work at it. I mean, I
What's
provide.
the important part that you want us to know? Why did Haynes and McMillian, and why did you decide to come to caring for others? I mean, you could take your skills anywhere. Why come here?
Caring for others, first of all, is family oriented, and is the kind of place that care about individuals. They care about their students. They care about the education that the student need in order to gain employment, or in order for the student to get to the next level. The owner is very sensitive about, he cares about people. He gives back to his community, and that's what made me come here. And what else intrigued me so much is because my daughter Jocelyn Washington is opening up a practice here, and I decided I said, well, this is a nice school, so I decided to come to Caring for Others, so it'll show that we're combined with a medical school that has the knowledge, that been in business, and it's black-owned business. So what better not if you see a young entrepreneur, been here for 8 years, and has the fluent to help his people, to help people of all creed and all colors. And I've seen a lot of people walk in, and when you have a young man like Mr. Corey Butler that's so powerful, why not? And that's the enjoyment part of it.
That's wonderful. That's wonderful. Okay, I want you to show me around. Okay,
great. So let me take you a tour of Caring for Others Academy.
Okay.
This area here is where they practice to do the hand washing. And this is where they practice to do the hand washing before they take their state board. They have to learn hand washing techniques as they're working with the patient. So they do hand washing here and mouth care.
Okay, I got you.
Okay. And in this area, this is another area where we do the clinical. This is where we do the state board clinical, where the state comes in, and this is the part where we actually, they do the state texting. The state texting is one student at a time when they do their clinical. This is the clinical part. This is where they're actually dealing with the patient.
So we have 3 different areas we do the clinical part in. One is for teaching, and and these 2 are for state board.
A hospital bed?
Yes.
Hospital gowns? Wow. Wow. Looks like even hospital food over there.
Yes, it is. They have to show how they feed the patient. We do a class on that also.
Wow.
Feeding techniques and fluid drainage. We do all different kind of classes on the topic.
Wow.
Over here we have another clinical area where we do our state board testing, and you actually do it with a dummy. So this is a simulation of the dummy where we do other state board testing in the facility.
These some really realistic looking dummies.
Yep.
And again, this is where you learn to take care of the affected area first and brush the teeth and make the bed and hygiene, everything on this one.
Actually, this part here, that's over there on that side. This part here, these 2 dummies here are the ones you actually take your state board on.
Oh my goodness.
Right, this one here is actually for state board and the GED program.
Impressive. I like the little privacy curtain too.
Yes. There's some false ones.
The storms of life are raging. Sometimes we have to be broken down so that we can be rebuilt into what we're actually meant to be. When the struggle to climb becomes just too heavy, and when God's voice becomes silent in your ear, just hold on, because a queen is about to emerge. The new book by the Queen Bee is entitled Last Week I Wanted to Die, published by True Soul Publishing, an umbrella for survivors. The revealing story of suicide, pain, and depression. The Queen Bee, Angie B, has emerged as a business owner, ministry leader, and a faithful child of God. This story is just the beginning. Last week I Wanted to Die, on sale now at thequeenbee.com.
Hello everyone, welcome to today's rendition of Video News. My name is Angie B, and I'm really excited about being your reporter for today.
This is Shop the Door Price. Y'all please buy $5 around here.
Ain't doing something to you, somebody doing something to somebody that you know. Right. So this one in books, you just slip it to the sister at the church. And it's not going to necessarily tell her what to do, but it'll let her know she's not by herself.
There's a pit in my heart.